All right. Well, good afternoon, good evening, and thank you for joining us. This is our first kickoff event for Stay Healthy 365. We are super excited and honored to have two amazing doctors to kick off this event. So, what I want to do is go through the presentations and then we can take it from there. Um, so everyone has been asking me to kick off this health and wellness network, but this is one of those many projects that we've been working on. I'm happy to have this launch. Um, Now, just a little bit my for those of you who don't know me personally, I just want to share something about my background. This is one of the many projects that I work on. I'm the co-founder and CEO of Easy Expo and AIX Network. I am also a CTO of a private equity firm, and there's many projects that at work. And I'm also a co-host of a Money Smart show. That is, I'm working with Brian Johnson. He's the portfolio managers using the same platform that we do podcasts every Saturday. So this is the platform has been used by many different customers already, and we've been doing that for the last couple of months already. The whole idea is to bring everyone together and be able to uh, have an ongoing discussion. Uh, Even after the event's over, you can always come in to actually have an ongoing chat. All right, so let's talk about today's agenda, right? Today's agenda is about health and wellness. As we all know, this is a really serious issue that we have not been able to address for most part, partly because this is a very complex issue. So, but if you look at the slide, the U.S. has the most expensive healthcare in the world. Well, that has become a serious national crisis. And this is why we gotta have it on discussion on how we can be focused on how we should focus on the preventive care so that people don't get sick easily. This is another numbers that actually U.S. has the highest public health spending as percentage of gross domestic products. So this is seriously a problem. A little bit on the platform. There are many tools out there, right? There are many apps you see on the slide. We really want to simplify things instead of going multiple applications and log into multiple systems. Here's a platform we can actually go into, uh, has all the pieces in one place. We have chat, we have conference, expo, uh, and uh, and then we have auditorium. So this is everything all combined into one single place, so that it makes it easier for people to share information and so forth. The whole idea of this platform is goes beyond um, the uh, uh, the healthcare, but also be able to bring everyone together and actually share information and start the ongoing communications where we can collaborate, not just one day, but every day. I'm not going to go through the virtual booth space. This is something that just want to let people know there are virtual booths in the platform that people can check in. We have AI application. I'm not going to go through that, but this is one thing that can help everyone business. We have AI social booster, AI SEO. All right, so let me introduce today's guest speakers, Dr. Francis, and I let the AI assistant introduce you. How's that?
That's good. Is a distinguished primary care physician from Nigeria. She graduated from the State Medical Academy in St. Petersburg, Russia, in 1996, completed her internal medicine/pediatric residency at the University at Buffalo, and finished her family medicine residency at Kanema Memorial Medical Center in 2007. Key accomplishments. Founded Rotha Family Medicine, 2007, established a comprehensive primary care practice in Buffalo, New York, emphasizing a whole-person approach to healthcare. Advocate for patient education, promotes patient empowerment and education, fostering strong patient-doctor partnerships. Collaborative healthcare, partnered with other providers to address root causes of diseases and ensure quality healthcare. Dr. Ilisu's career exemplifies her dedication to patient-centered care, education, and empowerment in healthcare.
Well, I hope everything is correct, Dr. Francis.
Dr. Francis.
All right. Now, Dr. Victoria.
Dr. Victoria J. Mondlog, recently retired from Waukesha, Wisconsin, has made a significant impact in healthcare. As president and founder of Victoria J. Mondlog, MD, and former medical director of Wisconsin Stem Cell LLC, she has over 35 years of experience in women's health, family medicine, and preventative health and wellness. Key accomplishments. Education, earned her medical degree from the Medical College of Wisconsin. Specialization, pioneered bioidentical hormone counseling for women and men. Recognition, Most Empowered Female Physician of 2022, and received a Lifetime Achievement Award in 2023. Dr. Monlock now focuses on patient education through her hormonal research. She is also an accomplished author with 2 published books, Blossoming, Becoming a Woman in Full Bloom, Perimenopause, Menopause, Postmenopause, and Beyond. She is working on additional books on hormone balancing for both women and men. Dr. Monlock's career exemplifies her dedication to patient empowerment and education, making invaluable contributions to the field.
All right, Dr. Victoria, I hope that everything is correct.
Thank you.
All right, well, thank you for both of you for supporting this kickoff events. Let me just go directly to the questions. Now, these 3 questions are kind of interesting because this is one thing that I'm sure everyone has been thinking about, right? I mean, for myself personally, I'm all about alternative medicines. You know, I've been using some of them already. I mean, before, like herbal supplements and stuff like that. So these are 3 questions. I would love to have both of you to comment. The first one is, how can traditional medicine and alternative health solution work together to create a more comprehensive approach to patient care? And then the second one is empowering patients through educations. How can we empower patients to become active participants in their own health journey by educating them about both traditional and alternative options? Wow, this is kind of all loaded questions. And the last one is the future of holistic healthcare. What are your predictions for the future of healthcare? How do you see alternative and traditional medicine evolving and collaborating? So please, Dr. Francis, Dr. Victoria, please go ahead.
Well, I'll go ahead and start off. having been trained back in the 80s in traditional medicine, I came and found very quickly that traditional medicine didn't have all the answers. And when it thought it had the answers, it really didn't. And especially as an OBGYN, my field, there was very little science in women's health. And it was as if people didn't want to look for the source of why there was a problem. They simply were content with covering it up with birth control pills or using devices that had medication within them. And it was very frustrating to try to help patients through some of the issues they had. Issues as easy as heavy periods or migraines or perimenopausal hormone swings that look like other diagnoses like increased GERD or again migraines or GI tract issues, when really they were hormonal issues of hormone swing, but nobody would check hormone levels. So I started not only doing the blood work to follow and track female and then male hormone levels and developed the graphs. I did the research and developed the graphs to tell about age appropriate medicine, but even doing hormone replacement, how do we still deal with some of the symptoms? You know, not all GERD medication is good for people. It can cause cancer. So why can't we go back to things like baking soda and water? Why can't we go back to herbal remedies? Why can't we go back to the gut biome? Why can't we recognize there's inflammation in the gut and that may be coming from our food sources? So looking at medicine from a strictly pharmaceutical traditional model is falling short. We need to go back and look at herbal, and non-traditional and complementary and even regenerative and energy methods. Chinese acupuncture does tremendous work in helping people with unblocking blocked lymphatic passages. So we have to recognize there was healing before we had Western medicine. So blending the best of the best is always the best approach.
Yeah, thank you.
Yeah.
I 100% agree with you. I used to take my mom and parents for the Chinese acupuncture, and that has been pretty effective in certain things like pain management and so forth. But the other challenge is that the healthcare insurance doesn't cover some of these other things as well. So that's another big challenge, right? Dr. Francis, have you have any add to that questions? You focus
But
on.
no, I mean, well said, well said. It's really unfortunate that it looks like we decided to turn blind eyes to other avenues of treatment, other resources from nature, from God-given potentials that we have, just because we develop science. And don't get me wrong, thank God for science. There's a place for that, and we are. We appreciate all the research and all the new innovative therapies that are coming up. The problem is we just cannot do one and not the other. And one of the reasons I'm really excited about this networking and platform is that we're here to provide a voice of wisdom. We're here to provide some balance. We're here to help people understand that it's not this or the other, it's what works for an individual. Let's get down to the root cause of problem, taking each person, each condition at a time. The so-called Western medicine, Orthodox medicine, whatever we call it, that we trained in, it just seems like we take everybody to be the same size fit all. If Prozac works for B, it will work for A. You know, some people don't need the same medication. Some people need different approach. So we're here to highlight the importance of going back to the basics. First of all, let's learn to not just put Band-Aid on conditions. Let's learn to look back, look deep, find out what is going on, what is the root cause of the problem, and then look at every area to get resource for treatment, not just prescription. Before you even get to prescription, a lot of things, like Victoria said, could be fixed with just food that we eat. I just hope that it's not too late for us here in America, because we are so far on the wrong side. But there's beginning to be a little bit of talk. I hear you talking about acupuncture. I saw that some insurances are beginning to add that in the benefit, but patients who don't know about it are not interested. They don't even know that they have it. They're still coming to me looking for prescription. I'll tell them, have you tried this? They say, oh, it's not covered. Well, they're beginning to add a few, but still a long way to go. So absolutely, we need to go back to nature. We need to go back to what we put in our body, how much we move, and how much we, just nurture our body. The whole goal is to give the body what it needs to heal itself. The body has the power to heal itself. We need to give the body opportunity, and you have to do it by making sure that the body has everything it needs to, to regenerate, to recoup, to recover. So I'm really excited about this. We have a lot to learn from one another, and we have a lot of topics that we can talk about and give people meaningful information that they can then use and make informed decision about their health.
Yeah, sounds great. So let's move on to the second question. That is, regarding how we can empower patients through education. So, and how we can empower patients to become more active participants in their own health journey by educating them about both traditional and alternative options. So this is really a critical question, especially now we have so much information readily accessible, right? So you don't know which one is correct. And then,
Well, it's not a correct versus incorrect. It's that you're absolutely right. What medicine has to do is respect the patient in front of them and let the patient be heard and actually respect what they're saying to you. They live in their body, you don't. And too often what Western medicine will do is they will hear the first 30 seconds of what a patient says, and they will automatically tailor the direction they're going to take their care for that patient based on that first 30 seconds. But the patient may have several things to say. And so my approach was always with patients, I want you to tell me all of the things, and I had a checklist for them to check. Tell me all of your symptoms. Is it okay with you if I can improve the top 3 of your symptoms? Would that be okay with you? Which just blew their mind, because now they were being respected and heard. And then I would tell them, I'm going to approach this by balancing with blood work the 4 hormone groups in your body, because that is something that traditional medicine will not do. But if we balance those 4 hormone groups, I can get rid of the top 3 of your symptoms. And is that okay with you? Asking that last question, is that okay with you, now brings the patient in as a partner with you. And not only are partnering with that patient, you're individualizing their care, and you're educating them about what their labs mean, what balancing those hormonal labs means. And those patients would routinely tell me they felt 15 to 20 years younger than their stated age. Oh my gosh, can you do this for my spouse? Can you do this for my parents? Can you do? Of course. So it's all about doing medicine from a scientific approach of balancing hormones. It's covered by insurance, it's blood work, trending that to keep the balance going, and including the patient in their individualized care approach and plan.
Yeah.
Yes.
Very interesting. Yeah.
Yeah.
Anything you want to add to Dr. Francis for the?
Yeah, I just want to emphasize the problem we're having with educating patients is the system, especially the system we are practicing in the United States. It just doesn't allow you the time. The control was taken out, taken away from the patient and the provider. So you're being told what to do. You're being told what is covered. You're being told how much, how you practice, and it's not working. It's not benefiting the patient nor the provider. No wonder the providers are burned out. The providers are not satisfied. The patients are not satisfied. There's this frustration of, unfortunately, the payment system in the country. The insurance companies have control. Unfortunately, patient care is not their priority. Their priority is their shareholders, profit over patient. And that is the biggest problem we have in this country. I have a private family practice in Buffalo for 18 years. My goal was to really, up until now, help patients understand what the story is about. You cannot do that in 10 minutes. You cannot do it in 15 minutes. 15 minutes not even enough to hear the patient out. You need to hear the patient. You need to, verify that you understand what they're saying. Then you work together, like Victoria said, work together so that you can come up with a plan. It does not happen. And some of us who are doing it, you will do it. You do well for your patients. But if your goal in the practice is to make money, you cannot do it because nobody rewards you, nobody pays for it. But for those of us who have a higher priority, which is the impact, sometimes life is not about how much you make. Don't get me wrong, we're in business to pay our bills, but impact sometimes can be more important than that profit. So we have to keep that in mind. It just seems like there are few of us thinking that way, but when we start speaking, when we start, making sure that our thoughts and mission is out there, we don't know who else is thinking this way. We have to find a way through collaboration to build a force. We need to develop a voice. People are looking for doctors that think the way we are thinking. They just don't know how to find them. And then when they find them, they don't know how to get their services covered. So educating patients that there are options, just that education, that information goes a long way. And I think that's the beginning. That's the beginning of the process. But who is going to do it? We're. That's what we're doing here. We have to find a way to get the message out. And once they understand, they will start demanding it. They will start requesting the true care, quality care.
Yeah. So much, so exciting. I think, I think insurance company should reward people to have a good health. Actually, that's maybe one way to lower the costs. Um,
Mhm.
Instead of giving everyone the same, have to pay the same premium, right? So it's like an auto
Yeah.
insurance, Oh, you have a good driver, good record. You should get
Mhm.
lower deduction or something like that.
True, true. It's
Mhm.
funny. It's
There's
funny you said that. Yeah. They try to do that. They try to say if you go to your doctor and get your annual preventive visit, we'll send you. Some of them do $25 gift card, $50 gift card, but it's a caricature. It's caricature. The fact that they visited the doctor, it doesn't mean much. It depends on what happened when they got there and how much information did they get and where did the information lead them. Did it really truly lead them to being healthier? So
yeah,
nobody goes to check that. You just have to check off. Yes, I had an appointment with my primary care doctor and they count it as incentive. Let's give you $25. So if we can let people know what you need to accomplish with that annual preventive visit, like getting down to your status. Where are you in your status? And then what can you do to improve that and actually do something? Have someone guide the patient to what they can do.
yeah. I think that's a very good point. It's like I'm currently trying to lose some weight, lose some pounds. It's tough.
Yeah,
I
yeah.
mean, I mean, and I try to take a walk with my wife, 2 to 3 miles a day. That's
Mm,
I try to
that's
make it like
good.
a routine, but it's
Mm.
it's challenging. It is challenging. Now, last question is kind of interesting. What are your predictions for the future of healthcare? How do you see alternative and traditional medicine evolving and collaborating?
Well, yeah, I'm going to dovetail with part of the last question to help answer this question. I want to echo what Dr. Francis was saying, that physicians are not able to make the choices that patients think they should make to guide their healthcare. The statistic that is out there presently is that 77% of doctors are employed by either a hospital or by an insurance company, which means the doctor does not have control. They are told what tests they can do, what laboratory tests they can do, and what protocols of medicine they can follow, what protocols of medicine they cannot follow. And it's usually driven by the profit margin of the hospital. In other
Mm,
words, the hospital has an expectation of profit,
Mhm.
and the patient has the expectation of healthcare. And the two are different expectations. So the
Absolutely.
patient has really no idea that the doctor can't go certain directions with their healthcare.
Mhm.
And the
Mhm.
doctor, if they spend too much time explaining that, can get docked in their pay, they can get docked in their vacation, and they can get fired for not doing the proper number of patients per day or number of referrals for procedures or referrals
Mhm.
to specialists. So
Mhm.
the expectations of both are at 180 degrees from each other. So what needs
Mhm.
to happen, we're not going to just suddenly overnight have 77% of docs go back to being independent docs. That number may actually get to be a higher amount. But what has to happen is that we need to use tools like trending blood work, doing that blood work using a tool like AI to help us understand what these trends in their blood work mean, allow these doctors to do the proper blood work. Look for inflammatory markers like homocysteine and CRP. Look for the 4 hormonal groups and balance them. And now, even in a shortened visit, we are letting the trending of blood work help guide our decisions, and knowing that insurance companies are going to be, they're going to be profitable no matter what. It's the 80-20 rule. 80% of the patients pay their premiums, but only 20% really use that monetary. So they're going to get paid no matter what, those insurance companies. They have coffers that are so big and so deep that we can't even imagine the number of zeros that go after the coffers that they have. They're in the trillions. But more importantly is, how do we as healthcare providers, how do we change and bridge those opposite expectations? How do we follow our Hippocratic oath? How do we service our patient best? And I think that what we have to do is realize the labs that we need to do, how we can trend that in that shortened period of time that we see a patient in. And we have to use the tools that we have in front of us, but AI is going to give us an advantage to allow us to trend more information faster. And if we can educate a patient by handing them what their trended blood work looks like with the parameters for optimal health, not just are you in range, but are you in optimal health range, that is going to be hugely empowering to patients to tell them you are on track or you're off track. And the next time we see you, the next set of labs, we will hopefully get you back in track. And it may be something as simple as, Matt, you were saying you go for a walk with your wife after dinner. Well, how many steps a day are you doing? What heart rate are you achieving? You know, are you doing things that are actually increasing your aerobic exercise capacity? Or are you simply, yes, I've checked the box, I take a walk? So I'm not picking on you, Matt, but I'm just saying we have to educate patients to what we mean when we say you need to do aerobic exercise. What does that mean?
Yeah, that's great. Yeah, it's about 5,000 steps.
Yeah.
I just bought a watch just for that. This is to track it every day. My goodness. You know, speaking of AI, you know, and I've been thinking about AI, you know, because there's so much stuff going on right now from Google, and there's a lot of amazing tools out there. You know, would you see AI going to be a huge component to reducing the healthcare costs, not just in America, I'm sure all around the world as well? How would
Well, if I can just expound on what I just said.
Yeah.
I used traditional flow sheets. I did that for 20 years with my patients, and that's how I compiled all of the research to be able to come up with the graphs that I came up with for age-appropriate hormone to put in the 2 books that I've written. And these 2 books really are written as a patient education resource, because it's the patient that needs to understand what is going on with them. So the first is my adolescent book that talks about the hormone imbalances that adolescents go through. But by the same token, this is the book I wrote for the perimenopausal, menopausal, postmenopausal woman, because her hormone swings are forced upon her by nature. And how does that impact their health? How does that impact things like osteoporosis, breast cancer, heart attack, stroke, and not having those hormones because there's an increase in all of those things, but having hormone back in place actually decreases breast cancer, heart attack, stroke, decreases osteoporosis, and actually is preventive for Alzheimer's. And nobody wants Alzheimer's. Nobody. Yet nobody talks about the 20, 25 years of things that we can do in our everyday life that helps prevent and even reverse Alzheimer's. And a lot of it has to do with proper hormone balance, balancing your body with nutrition and exercise, getting rid of inflammation, trending this so that people understand what their end goal is. It may be preventing Alzheimer's. It may be feeling 15 to 20 years younger, but you have to impress on them you're doing this for a reason. And if you feel good, do you want to continue to feel good? This is really anti-aging at its best. And AI can help us do that, but we have to have the buy-in of the patient and the ability to work what we know how to work, lab work, trending lab work, and how that applies back to the patient's health on an individual basis.
Yeah, it's very interesting. Dr. Francis, any comments on the um, last question?
Yeah, first of all, it's interesting that to piggyback on what Dr. Victoria is saying is that yes, we will educate patients, but remember that a lot of doctors, a lot of practitioners have given up hope on really being able to do the right thing for their patients. Our thinking have been so impacted by the system we're practicing that some people, when you talk, they're like, that's not going to happen. I don't have to do that. I don't have the time to do it. It's not possible. It's not. We have to bring some education also to the providers. And Matt, one of the things that we probably will do in the future is probably find a way to even let these practitioners know that there is hope. There's a way that this can be done. It's still possible to do the right thing for their patients. And like Dr. Victoria said, we can have tools that will make it easier. Things like collecting information, the questionnaires, like being able to have an AI-powered questionnaire that patients can answer on their own, and it will summarize the result for the provider, guiding the provider to know what types of labs they will order. And after they've ordered the labs, being able to quickly interpret the lab and point the patient to the right direction. So there's a lot of education to be done. There's a lot of restoring hope, restoring faith in our profession, in our calling. Medicine is a calling. We went through rigorous training. Some of us are in medicine, yes, to make a living, but mainly because of the calling, because of the mission that we all have in our heart. So we have to first of all help our colleagues in some way, which we'll have to decide in the future. There are other people who are doing this, but everybody is operating in a silo. Their voices are all fragmented. So we have to find a way to start bringing this up to the forefront, start speaking out, start letting doctors know, listen, there's another way. It does not have to be this way. You don't have to be burned out. You don't have to just show prescription to your patients. You can do better. And then we come back and work together and develop tools. Someone has to take the challenge, but with us having the knowledge and having the things that we need people like you, Matt, to develop for us. It can be as simple as taking the questionnaire, let's say, that we give our patient. I do functional medicine. So I will get functional medicine intake and survey. It's a lot of questions, but if they take patient and do it, I learn a lot. I do a lot with that. It makes things, at the end, they are like, wow, I'm glad you gave me this questionnaire. But I have to manually review this questionnaire. I will like a situation where this questionnaire is taken and plugged in a way where it's done digitally and analyzed by AI. And this is finally possible. We just have to get there. So I'm really excited with what is coming. I know a lot of people think that AI is going to either hurt us or give or profit us. It's not this or the other. We have to find balance on how to use it and use it to empower us to do better. So I see a lot of opportunity as far as alternative and traditional medicine evolving and collaborating. It's already, it's just like those who are doing it are not loud. Our voices are not loud enough to be heard. But it will happen through platforms like this, through collaborations and us opening our mind up to embrace digital and virtual tools that will give us visibility. We just need visibility, and we can pull each other together and really let the people know that we are here. There are people who practice differently, and you are welcome to come to us. So I know it will eventually become more accessible and more more open in the future.
Yeah. And Dr. Francis, the tool that I used, I'll make
Mm-hmm.
this available to everybody, but I condensed all of these symptoms onto one
Mm-hmm.
single sheet for a patient
Mm-hmm.
to download ahead of time and then
Mm-hmm.
bring it in. And that's easily converted to an AI because now
Yes,
you're following
Right.
initial symptoms and you're following progress. So,
absolutely.
Matt,
You
there's
know,
plenty of tools we'll be able to use.
yeah, please share your links on the chat so that we can share with anyone. This is a recording we'll be posting to the auditorium. Yeah, this is a lot of great information. I was watching the latest announcements from OpenAI, ChatGPT 4.0. Uh, my goodness, I can see that will be a digital twins for every doctor. You have a assistant be able to engage with the patients and start chatting with the patient, asking all the information and bringing back all the analysis, um, for further maybe analysis. And then
Yeah.
the way I actually see it is that, you know, especially for mental health, that
Mm-hmm.
would be a really powerful tool
Yeah.
because here's a AI assistant can work 24 by 7, no complaint,
Yeah.
and be very patient. My goodness. And this, the technology is already here. I think the
Yeah.
next thing is how we can. Um, I think it's just the policy and the collaboration at a higher level. Maybe to start with the nonprofit or think something like that. I think
Mm-hmm.
that would be. The technology is going to get better and better. Uh, just like our platform, we were getting better and better.
Yes. Yes.
So
And you know, one of the things we have to be careful about, why I say that we have to be alert and willing to contribute to how this AI and healthcare intercept, is that we don't want what happened with electronic health record to happen here. Doctors sat back. We sat back and we thought, oh, technology is coming. They're going to bring it. It's going to help us. If you ask any doctor, one of the reasons doctors are burned out is this technology that impacts their ability to get to what they want to do for their patients.
mm,
We spend so much time collecting data and collecting information and inputting information that will benefit insurance companies and everyone else but our patient. It was not oriented on the well-being of patient or the provider. So this was pushed to us, and we are struggling because these electronic health records at their best are automated to help with billing, but you have to see the patient first, provide service to the patient, actually help your patient get better before you get to putting in codes and things to do billing. Someone has to do it. So we allowed electronic healthcare records to really develop this expensive, um, just tiring, exhausting systems that does not really help that much when it comes to patient care. What we are hoping is that at this beginning, when this whole conversation about how does AI and healthcare intercept, how would they work together, what is the best approach, doctors, the providers, and the patients have to be involved in bringing out the tools. If we let this be, and not to disregard the contributions of the technology-based companies and the tech specialists, all good, but we need to be there to make sure that the direction of the collaboration and integration, it's actually something that will help us do better for our patients, that will help us reduce stress on both the patient and the provider. Electronic health record did not do that. It did the opposite, and it's hurting providers. It's one of the reasons where patients are actually frustrated, because when they walk into the room, the provider is gazing on the computer. When they are leaving the room, the provider is still gazing on the computer. If you don't do that, you're not going to be up to date with your chart. You're not going to be up to date with the requirements of the data that insurance companies and your hospital or employer wants you to generate. So we really need to find a way to make sure that our voice and the voice of our patients, it's hard as we see this evolution happen.
Wow.
Well, and yeah, and the other thing I'd like to say, and thank you, you're right on, Dr. Francis, is that most of the electronic medical records were designed to help hospitals prevent lawsuits. They were not they were not put in place for doctors to be able to manage outpatient care. They were put in place to help hospitals manage inpatient legal issues of care, time of care, who distributed what medicine at what time. And Epic, the biggest medical record in the country, is designed for hospitals. It is very poorly designed for any interface with an outpatient physician office. So you're right on, Dr. Francis.
Thank you.
Wow. Okay. Well, we almost the end of the hour. Let me just wrap it up. I really thank you for all the great information. So what I would do is, it's kind of interesting. And I want to maybe just share with you this information here. I think this kind of, I just went to the Gemini Google and did a check on one of the top 5 health issues in the United States. And guess what I found? Chronic disease, substance abuse, addiction. Oh my God. Mental health. Oh God. What the?
Yeah.
Wow.
Yeah.
Because I'm trying to put together sort of a topics to have a panel discussion on these kind of things in every session. So, but anyway, if you know of any guest speakers, we're welcome to have any, anyone actually willing to collaborate with us. We
Mhm.
promote everyone as well. And this is how we can collaborate with everyone and actually contribute with great information to share with all everyone. So with that, once again, I thank both of you, Dr. Francis and Dr. Victoria, and also will also work with you on your virtual booth. This is a ground zero. We starting here. This is a exciting. So that I love to get your feedback. So and how we move forward. Any other questions?
No, I just want to say thank you, Matt, for putting this together. This was a very excellent forum for some of these topics that are usually kept behind closed doors to come out in the open. And so I applaud you for taking this topic, which is a difficult topic for many people to hear. Some have never heard it at all, but to bring this out into the open and allow an honest discussion to happen.
Yeah, so we will have a health and wellness smart channel in YouTube channel. We will use the AI to blast it off across.
Yeah.
Let me tell you, I've been working with the same platform with Brian Johnson for the Money Smart Show. And I noticed that Google put the short video very high algorithm, and once I put it, like, I see thousands, hundreds of views. They really put it out in the YouTube channel. So this is, and we all know healthcare is a big issue.
Yes.
I
Yes.
bet you're going to see a lot of traction coming to you, coming to us.
Yes. Yes. And I think even those topics that you put up on Google, talking about them, those are for real. See, science and technology has, and God's blessing has allowed America to evolve away from infectious diseases, malnutrition, typical things that affect poor countries. And then we created man-made diseases like diabetes that is coming. So those are hot topics. So whenever you're ready to do it, we can get you resources, get you speakers that can speak to those topics, because people are looking for information on how to escape them. So once again, thank you so much. I agree with Dr. Victoria. This is a very good opportunity for us. We're going to find a way to let our colleagues know about this, listen in, contribute, collaborate. And I think this is going to be great. It's going to be great.
Yeah, absolutely. I mean, all right, well, great. And we'd love to collaborate with any nonprofit organizations, because they got all the members can come in as well. So we'll give them a virtual booth. Promote them. All right.
Yes.
Well, anyway, once again, thank you very much for both of you for this amazing event. We will continue to move forward. So the next one will be in 2 weeks. Same day, same time, Wednesday at 4. And I have not decided the topics. Is probably on the chronic disease. The number one on the list.
Yes,
All right.
Yes. All right. All right.
Thank you.
Thank you
you so much.
Thank
Have
you.
a wonderful day, evening.
Thank you. Bye-bye.